Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute video podcast. We are here with Dr. Zahra Figueredo. She's still in Canada, but how you doing, doctor?
Very good, Luis. Thank you so much. How are you doing today?
I'm doing great. Just enjoying this beautiful weather in Guatemala.
Yep, I'm up here in Canada for the season, and it's a little bit chilly, but not as much snow as usual. You know, this whole global warming, it's quite impressive. There for a place that should have quite a bit of snow for by now, the temperatures are above zero, so it's a little bit scary. It's a little bit surprising, but yeah, it is what it is, I guess.
I was gonna say that's scary, but that's global warming, and there's nothing we can do about it. Well, there's a
Right.
lot that we can do about it, but people, but let's leave it to the politicians.
Yes, I know, right? That's what it comes down to. But we can play a part, you know, as minor as it may seem, we can all still play a part in helping the environment. So, oh, and then we could save that for another podcast.
That's right. We're gonna become political if we keep talking about that.
That's right. That's
But
right.
but we do have a very interesting topic today, and we are a big part of healing. So this podcast is about how the stem cells can help with the sports injuries. So, doctor, is there any help for all these sport people out there that had suffered any injuries with the stem cells?
Oh, wow. Yes, that is a very loaded question and absolutely a big resounding yes. Um, our results they speak for themselves. You know, with the stem cells, when we have sports injuries, we have a lot of, soccer players, as we say in Latin America and in Europe, football. So European football and Latin American football, we treat a lot of those types of athletes, as well as, you know, just regular Joes, you know, with injuries from the gym, lifting too much weight, a rotator cuff injury, um, a torn meniscus or ligament, um, tennis elbow, golfer's elbow, various different sports or movement injuries, and even, you know, accidents, so skiing and so on and so forth. We have a lot of people from up north that come down, and so yes, we treat all kinds of injuries. Including, you know, we I mentioned the joints and also ligaments and tendons that tend to be torn or damaged or injured in various sports or gym activities or accidents. We very commonly have cartilage injuries. So in usually it's we have a lot of knee injuries, or even just normal wear and tear from overuse, or you know, in the wrists or the knees or the ankles. Um, and then what I mentioned, rotator cuff, which is another very common one, and the elbows. Again, tennis elbow and those types of injuries where we're dealing with the joint itself, where there's cartilage, and then in the case of the knee, there's meniscus, torn and damaged meniscus, worn cartilage or torn cartilage. Sometimes even bone injuries that are involved with these types of injuries. So bone damage. Um, and then with elbows and rotator cuff, we're not only dealing with the joint, but we're very often dealing with torn ligaments and tendons, which are very difficult to heal, either on their own or without surgery. So stem cells very often, more almost always, can keep a patient from having to have surgery, depending on the degree of the tear. So we take each individual case and analyze it in order to have the best possible outcomes. And so it's a very personalized approach. And so those are the types of injuries that we treat in all kinds of areas in the body. You know, there's another very common one, TMJ, the mandibular joint, where when we chew, that's a very common one. So that's another one that we will treat with stem cells, and the clicking in the joint. And for some people, it can be very, very problematic. Usually, from an accident, a car accident, or something like that. And so yes, those are the most common types of injuries that we treat when it comes to sports injuries, and that can lead to arthritis and degenerative conditions.
Doctor, and you say that will be you say something about the best possible outcome, but what would the patient feel with these examples that you gave us after receiving the treatment?
Mm, yes. What our goal is for diminish or completely eliminate pain and the need for pain medications. It's so important. These two points is first of all that the patient is not using pain medications anymore, and not feeling pain on normal activity, but then also being able to resume normal activity, and being able to do the things that increase the quality of life. So being able to play sports again, and run again, and play tennis again, and weight lift again. That's the goal, and without pain, and without having to take pain medication. And these are the things that we absolutely do accomplish with stem cell treatments at the Stem Cell Healing Institute. So that's what we're looking to accomplish in regenerating the damaged tendon or ligament or cartilage, or meniscus or bone, in many cases when there's damaged bone. Um, and skin. Sometimes, if there's a damage to skin tissue, we're looking at regenerating with the stem cells, where the stem cells are um, they're dividing and regenerating themselves in order to regenerate a tissue. And so that's what we're looking to do. So we're literally building and reconstructing tissue back up, so that whatever damage has caused pain or diminished mobility, or the uh, um, where a patient's quality of life is diminished because they can't play a sport that they loved, or they can't do certain things that they used to be able to do, because they've become immobile, or or they're using a cane or a walker. And we've absolutely seen patients throw away their canes, donate their canes and their walkers, and just being able to enjoy life again. And that's what it all comes down to.
And can also work for scarring.
Scarring, absolutely, yes. So when we have scarring, we inject into the scar and around it in order for it to break it up a little bit, and for it to become more pliable, and that takes away. It helps with pain relief, as well as increasing mobility.
So in this case, can we combine stem cells and platelet lysate for sport injuries?
Yes. So, Louise, what we do is we have a proprietary cocktail of combining the stem cells, very, very high numbers of stem cells, as well as growth factors from the patient's own blood, as well as other stem cell growth factors, and um, a handful of other cofactors, in order to stimulate the best regeneration in those damaged tissues. So yes, so we do combine it with platelet lysate, and other cofactors to create this proprietary cocktail that just works so well for us.
In case you are wondering what platelet lysate is, you can listen to our previous podcast. We did talk about that. Do you think the sport athletes see the stem cell therapy as an option, doctor, for
Oh,
um,
mhm,
for future injuries in case for faster
absolutely.
recovery?
Yes, that's a really good point because in order to avoid very, very invasive surgeries, we have patients, we have athletes, we have, again, just regular Joes coming to us where we can keep them from having to have very, very invasive surgeries that have a very long recovery, a lot of rehab afterwards. A lot of pain, a lot of pain medications for months at a time, and recovery for months at a time. And we can avoid the need for that with the stem cell treatments. And absolutely, patients, we've treated professional patients where they have avoided the need for surgery, and they're playing their beloved sports again. And we've had even a lot of surgery candidate replacement knee replacement, joint replacement candidates, where we have avoided the need for surgery, with the a lot of just from wear and tear, and then the elderly, that just from old age there's that wear and tear, where we have avoided the need for surgery. And for some of the elderly, it's also deemed unsafe to have such a major surgery. So we have had a lot of success with those types of patients.
So for sure, a stem cell can help you in case you have an sport injury or any problem with the joints and tissues, right, doctor?
Mm-hmm. Absolutely. So we're looking at a downtime of maybe a couple of days as opposed to months, and it's not even really a downtime. We have actually the patient. We want the patient to be mobile right off the bat, and our motto is motion is lotion. And so we want the patient to be mobile right off the bat from day one. But it's just a matter of taking it easy so as not to damage the stem cells, and just to promote an environment for healing.
Awesome. And doctor, the patient has to come down to Guatemala for this treatment, right?
That's right, absolutely. Because the way that we do these treatments and grow the stem cells and combine them, as you mentioned, with the platelet lysate and other factors in a cocktail, none of that is allowed in the U.S. or Canada. And so we have a very, very efficacious, very safe and effective treatment that we have to do in Guatemala or outside of the U.S. And we choose to be in Guatemala because we're able to offer the patient a lot of very, very comprehensive treatment, and still be ethically priced. So that's really important to us.
But Guatemala is a very interesting place. And we always mention a few things or a few attractions that you can find in Guatemala. But, doctor, what is the feedback you receive from your patients after they visit Guatemala?
For Guatemala? Oh, goodness. Yes, they are very, very surprised at how beautiful the country is. It is very safe. There is so many landmarks and, natural, the ruins and the volcanoes. And I always mention this, the coffee farms. But yeah, there's so much nature and just beauty, and it really is a destination place. And most patients regret not having stayed longer or planned to stay longer. So it's a very positive experience for our patients.
And also within our plan, we do have contemplated the accommodations. Is that correct?
Correct, Louise. Thank you for mentioning that. Yes, so in our comprehensive treatment package, We include accommodations, 7 to 10 days accommodations, depending on what we're treating, as well as a personal driver to for airport transfers, all appointments, any small errands to be run. We because of our because the accommodations are like an Airbnb, very comfortable apartment. The driver helps with going shopping and helping with groceries and things like that.
Excellent. I don't know if I missed anything here, doctor, but this is the chance that you can add something to this podcast.
Just really quick, I know I've mentioned this in most of the past podcasts. However, I think it's worth mentioning again that our comprehensive treatment package is very, very comprehensive in that we do a pre treatment protocol. We start when you're still home, getting ready to come to Guatemala, with some dietary and supplemental additions and changes and modifications, and then we do a total detox program once they arrive, which involves a nutritional IV with suppositories and B vitamin shots, and we do oxygen therapy as well as growth hormone therapy and stem cell enhancement formula that is a combination of key herbs and minerals for the patient, personalized for the patient. And we also never neglect the patient's psyche. It's really important that the patient is in the healing mode and the mind frame of healing and positivity and all of those very important things. As you know, Louise, my motto and my philosophy is that our well-being is not just our physical body. So that is absolutely something that we don't neglect either.
Awesome, doctor. We really appreciate your time and your knowledge about the stem cells. And in case you have any questions, please send us an email to info@stemcellhealinginstitute.com. And by the end of the podcast, you will find all the information how to contact Dr. Figueredo, as well as all the social media from the Stem Cell Healing Institute. Doctor, you have an awesome time up in Canada.
Thank you, Louise. Thank you so much. And you enjoy the holidays as well.
Okay, you take care. Bye bye.
Thank you. Bye bye.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.